Hello, hello. Do you have my voice?
Yes, I do.
Sorry for interruption. Sorry, Melika, and I would like to thank Dr. Ghaffari for joining us. I would like to express my sincere appreciation, but I would like to apologize because of an urgent problem. I had to come to the hospital, to the path lab, and I asked my senior student Melika to moderate this panel. Thank you, Dr. Ghaffari, for accepting our invitation. And Melika, the stage is yours.
Thank you, Dr. Shakib. Hello, everyone. Good afternoon. Hello, Dr. Ghaffari. Good morning to you. And it's such a pleasure that you accepted our invitation to speak for us in the first virtual winter school of Tehran University of Medical Sciences. I may introduce you at first for the ones who don't know you. Dr. Ruby Ghaffari is Assistant Dean for Predoctoral Clinical Affairs and also Assistant Professor in the Department of Comprehensive Care at Tufts University, United States of America. It's such a pleasure to have you here today. And the title of her presentation, as you can all see, is the Clinical Teaching Overview at TUSDM. I hope everyone enjoys it. Thank you, Dr. Ghaffari. The stage is all yours.
Thank you very much. خدمت تمام همکاران گرامی سلام عرض میکنم. صدای من رو دارید شما؟
Yes, Dr. Ghaffari, we have your voice, but we don't have your video. If you may, please turn on your camera.
Okay.
And camera is... here we have mostly non-Persian speakers. Yes.
Not a problem. I just, out of respect, I wanted to say hello in my native language.
Thank you so much.
Okay. Do you have my video now?
Yes, we do.
Okay. First of all, it is an honor to be among such an amazing group of people this morning, my distinguished colleagues, and especially my future colleague, all the dental students. Today, I'm going to give you an overview of our clinical education at Tufts University School of Dental Medicine. As you can see here, Tufts University School of Dental Medicine, located at the heart of downtown Boston, the beautiful city of Boston. And many of you know that the dental education in the US is 4 years. We do roughly 2 years of preclinical work and 2 years in the clinic. This is just a picture of our gross anatomy lab where we dissect cadavers. At Tufts University, we do full body anatomy. We don't do only head and neck. In the first year, we have the integrated curriculum and the basic sciences. In the right, you see pictures of some of our conference rooms and classrooms. Obviously, in the first year, we do operative courses with a lot of preclinical projects. I'm sure you guys have the same sort of situation there. The students start assisting in the clinic, and roughly we ask for a minimum of 22 assists per each academic year. As we move on to the second year, the focus increases on the dental-related didactic and preclinical courses, such as fixed and removable pros, endodontics, oral pathology, radiology, pediatric dentistry, and ortho. Here is just a picture of, on the right, a few natural teeth that students are practicing endo on, and on the right, there is a surveyed and designed cast for a metal RPD. Again, some pictures of some of the practice spaces that our dental students use. On the right, we have the preclinical bench lab, and on the left, we have our state-of-the-art simulation lab clinic. As you can see, students work on mannequin heads in the simulation clinic, and you can see that they are practicing to learn how to do the face bow on the left picture. This is a funny picture that I thought I would share with you. Of course, we provide teeth to our students to practice on, but there's some students that they want to do a lot more. So we have a vending machine, as you can see on the right, that they can purchase teeth to practice on. Second year, again, they move on with their continuation of their ICP course, which is the Introduction to Clinical Protocols and Practice, and they do their assisting. And then they go into their rotation in pediatrics, ortho, perio, and oral surgery department. Again, another picture of students practicing how to place sutures. Now we go more into the predoctoral clinic, which starts towards the end of the second year. Tufts University School of Dental Medicine is the second largest dental school in the country. Our class size exceeds 240 students, so it is a very large class size. In order to make it a little bit more manageable and give the feeling of care in a small group, we divided the whole class into 6 group practices. We have 3 floors of DMD program, and in each floor, we have 2 group practices that each group has about 80 students, 40 third years and 40 fourth years. I just want to tell you a little bit about a pilot program that I started in 2014. My background comes from private practice. And when I went into academic world, I felt that there is a bit of a disconnect between the academic world and the real world. So I suggested that we will have a pilot program so we can adopt and implement some of the private practice models in our educational setting. And we did that in 2014. I led a year-long pilot program. And in what we did was we just basically chose practice coordinators and core faculty to work specifically with a group of students. So in every group, you will see 3 practice coordinators or PCs that basically run the group. These individuals are like advisors to the students. And then we have a core group of faculty that work with the specific students, and basically they work with them very closely and consistently and basically follow their progress. We also have staff. PRC, PRAs are similar to front desk people and schedulers. We have also brought dental assistants and floor managers into our predoctoral setting. The year of pilot was very successful. We felt that the education was better, our chair utilization was better, our material management also improved, and financially we did better. So overall, and students actually graduated sooner than they did in the past. So after the success of the pilot, the university adopted the pilot throughout all the floors of the clinic. I just want to share some pictures of different groups. This is the second floor, groups Atlantic and Back Bay. Third floor, groups Charlestown and Dorchester. And fourth floor, groups Exeter and Fairfield. Basically, in every group practice, they act like an independent private practice setting. In these group practices, we have practice coordinators that assign patients to the students. They supervise treatment planning, and also they ensure that students adhere to all the expectations, they follow all the requirements, they help them get patients, and they do reviews with them. They try to meet with them and go over all the care that they provide for the patients. They resolve um, issues that goes on the clinic, and they're basically similar to practice owners in a private practice setting. Then we have the core faculty in different disciplines that they give consultations, they supervise procedures. We also use PG perio and endo resident, and also I forgot to mention aesthetic resident, that they come to the pre-doctoral clinic and they teach. We have other DMD clinics. Endo has their own area, which is equipped with microscopes and X-ray unit and anything that they need. We have an emergency clinic that I'm very proud of, because we have been open throughout the COVID, and we have been providing dental care for all the people that could not get the care from their regular dentist or from the university due to the closure because of the pandemic. We also have a MCP clinic, which is very unique to our university, or some universities have them. I will go more in depth with this, but this is basically for medically compromised patients. We are a part of Tufts Hospital, so we tend to treat a lot of patients who have long list of medication and medical condition, people who are going through transplant, people who are going through major surgeries and cancer treatment, and we make sure that they get their dental treatment according to their medical condition and in a speedy process. We also have 2 areas of radiology and 2 DMD labs that students work in them. Students overall get a lot of support. They get in their ICP, that is introduction to the clinic. They get a lot of support from the faculty. They have TAs that work on the floor and off the clinical floors with them. We hold numerous workshops to get them ready for all their examination. And before COVID, we used to run monthly free patient screening to attract more patients to the clinics. I left the second item, which is pods. And again, I want to talk a little bit more about pods to you guys. We have started a program this year, which is we call it pods. The 3rd year and the 4th year work together as a pair on a patient. And basically, they, as the 3rd year comes into the clinic, they continue the care that the 4th year has been provided for the patient. And what happens is, as the 4th year is graduating, the patient is very familiar with the next provider, and it really helps the continuation of the care for the patient. Also, it creates camaraderie among the students. They bounce ideas off one another. They work together on the patient. They help one another. The 4th year student works as a mentor for the 3rd year. The 3rd year student assists the 4th year. All in all, it's been a very successful program. It also helps people to learn how to work together. This is just a glance at all the workshops that we do. I'm sure it's a little too small for you guys to see, but throughout the year, we do several workshops for our students. The end of the 2nd year, they're pretty much done with their required assist in all the areas. and then ICP workshop is done. Basically, they work as pair on each other. We have all kinds of workshops for few of them local anesthetic, impression on Facebook. They treat each other like a patient. They create a electronic health record for each other. They get to know Axiom, which is our dental software, before they actually treat patients. At this point, they are going into patient assignment. They join their pod as the junior partner. They sign for NPE, which is new patient encounter, and they start their clinical work and patient assignment and treatment. They still have about four didactic courses that is in their first half of their third year, and they still continue with all their departmental rotation and assists. We also have a mandatory 5 weeks community outreach externship program that students go to healthcare facilities, hospital, jails, and some other facilities that they work in a actual setting. At this point, they work on their national board written exam and also on their licensing exam. They also have a practice management course that basically goes over all the aspects of practicing dentistry, financial, legal part, and patient management. Just going to go through step by step of how they see patients. They sign up for new patient encounter, and they basically assess the patient to make sure the patient is a good fit for our clinic. If the patient has, let's say, for example, needs a full mouth implant, or a large amount of fixed, or their vertical dimension is lost, we do refer them to the specialty clinic. But if we feel that they're a good fit for our predoctoral clinic, we basically review all the school policies and protocols with them. We get all the consents from general medical, financial, and nowadays COVID. From them, we take radiographs, photos, and impressions, and we book a comprehensive evaluation appointment for them. Here, you can see they're being assessed by the student and the faculty. Impressions are taken, x-rays have been taken, and this is the second appointment, which is actually a comprehensive exam. I'm sure you do the same things. We do head and neck cancer screening, and we go quite in depth in terms of medical. We get lab reports, we talk to their physician, we have medical consult for all the people who have medical complexity. We have 4 faculty in our medicine department, and our medicine division is run by a physician. They do sign up and do a medical consult to make sure they know exactly how to treat the patient according to their medical condition, and if any changes needs to be made, or different options should be implemented for the patient. We do camera caries risk assessment on them. Perio consultation is big in our school. You might know Glickman, the father of Perio, who was from Tufts. So Perio is big in our school. We do restorative consultation. Of course, we do pros consultation with mounted cast, and if need be, endo consultation. We also have our TMD GELB Center, which is one of the biggest centers in the country. We are very fortunate to be able to work collaboratively with them and get TMD consultation for our patients. Oral medicine and oral path are very similar, and also oral surgery consultation if it's needed, as well as ortho. We do have a lot of gift program for implant, which many patients take advantage of them, and we do the implant consultation with different departments, from implant center to oral surgery to perio department. After all the consultations are done, the students will present the case to the PC practice coordinator with different options of treatment. The practice coordinator, the students, and the patient sit together and they decide on the final treatment plan according to the need of the patient, or could be financial reasons or a combination of all, and they finalize a treatment plan. And at this point, they phase and sequence the treatment plan. Here, as you can see, it's a period charting that the student has done. And as we phase and sequence, the first phase of treatment is normally perio. We decide if the patient is a gingivitis case or a periodontitis case. And according to that, we treat the patient. We also do case completes. We get the patient after 2 weeks to evaluate for gingivitis. And for periodontitis, we do often 4 to 6 weeks to make sure they follow up with their home care. And at that point, we call that a case complete and move on to the phase 2. On the right side, you guys see the minimum requirements for the perio department. We have several scaling, periodontitis case complete, gingivitis case complete, and competencies that they have to do. And also they go to the perio PG area and do surgical assist. Phase 2 is normally operative procedures. Again, we sequence the phase according to the priority in every arch. The minimum requirements is 40 lesions, and also they have competencies for amalgam and composite for posterior and anterior that they have to fulfill before graduation. In phase 3, we go through prosthodontic procedures, fixed and removable. This is just an example of our step card that basically every step that students do pay is faculty have to sign and verify that this was done right. Just going to give you a quick example. You bring the patient, you do the crown prep, you take the impression, the faculty on the floor would approve everything. Then you go to the second step of quality assurance, which is normally a program director or a more seasoned prosthodontic faculty who will review the impression. Once again, the impression gets sent to the lab, gets fabricated, comes back, goes back to QA again, and get evaluated, goes to the clinic floor and gets delivered, obviously with proper x-ray and proper clinical evaluation to make sure everything fits perfectly well. We also use CAD/CAM, ceramic crowns, and we fabricate many of those. And as we go much more digital, the usage of the CAD/CAM is going to increase tremendously. And I'm in the process of basically setting up calibration and training for all the faculty for the CAD/CAM. Also, a part of phase 3 is removable. As you can see in here, one of our students is setting teeth, and they set the teeth and then they send it to the lab for the processing. Again, this is a setup on the left, and this shows that the requirements, there's 10 fixed units, 3 arches of complete denture, RPD, post-core, implant diagnosis, and associated competencies that have to be done. Phase 4 is normally occlusal appliance. Again, we work with the TMD department and we fabricate these occlusal appliances in our own lab. If the patient needs bleaching, that would be at this stage 2, and you can see the required minimum requirements for each one of these services. This is just a odontogram of the a patient with phasing and sequencing for the treatment plan. We also have many other clinics. GPR and AEGD clinics are basically on the top right, you can see a picture of our GPR clinic, which is general practice residency that students do after graduation. for a year or two. And then we have advanced educational for general dentistry also. This lower picture is our emergency clinic. On the right, we have the radiology clinic and aesthetic clinic that is a postgraduate program, but they work with our comprehensive care very closely, and we really take advantage of them. They come to the clinic and our students go there to work with them collaboratively on big aesthetic cases. This is a selfie that is one of our faculty, Dr. Gold here, with the students in their medicine division and medicine rotation. This is a very unique program that we have. We do actually 5 weeks of hospital rotation, complete medicine, and we do a lot of seminars, discussion-based seminars. We go over very complex cases. A part of our medicine rotation also is orofacial pain center. We oral pathology, pediatric special needs clinic, tumor board, and ENT clinic. We also go into forensic dentistry as a part of our medicine education. We have many grants in our school. Ryan White is one of them. And this is for HIV patient. We have domestic violence for people who are violated by their domestic partner. We have funds for them to treat them. We have a few gift in kind program that a couple of very big implant companies provide, really provide a lot of funds for us to be able to do implants at a very low cost, and many of our patients take advantage of this program. We also have support grants that comes from our alumni office for many people who cannot afford the care that they need. Here on the right side, you see one of our medicine division faculty who is reviewing a case with one of the students. This is, we also have oral surgery requirements. Dr. Joy Chang on the right side is a program director for predoctoral clinics for the oral surgery. And you can see there is 10 extraction, competencies, flap management, suturing, local anesthesia, administration competency, and so on. I'm sure you have similar requirements in your school. This is our endodontic program, and again, to the right, you see a picture of one of our residents, and to the left are the requirements that we expect from our student. Endodontic again has their own bay, and students go to their bay to treat their patients. This is our pediatric requirements. On the left, we do see patients in their pediatric floor. They don't work with us on our predoctoral clinic. We go to pediatric area to work with them. As you can see again, these are all the requirements that we do have for the pediatrics. There's some other requirements. Again, we have exam competencies with evidence-based dentistry, post-treatment exams, which are at the end of a treatment, we evaluate the diagnosis, the treatments, that options that the student has given to the patient, the management of the patient, and we sort of look at all of that and make sure that everything has been done according to plan, carries assessment risk has been done, patient's education has been done, patient has been happy with the treatment, and they do 5 of those with the patient at the end of their 4th year. Obviously, they do phase 1 alginate competencies, and they do infection control audits as well. Other than all the competencies that we do on a daily basis, we do daily clinical assessments, which we call it DCA. These criteria for the DCAs are on 5 areas: knowledge, technical skills, organization, professionalism, and patient communication. This gets done on everything they do. Even when they assist, they get the DCA for that assist. Just a glance of the DCAs that we do. Also, we give them feedback if they have been below expectation, the reasoning and the ways they can improve, and also why they exceeded expectation and how they've been recognized for that. This is a new slide. This is, I'm sure, many of your schools do the same thing. Due to COVID pandemic, we have implemented new things to basically follow all the steps of infection control, social distancing in our community. We have a COVID app that we download, all of us, all the community members download, and we have to go through it before entering into the building. The flow of entrance and exit has changed. And also we have HVAC filtration system in our building. Every 10 minutes, the air gets filtered. We have plexi dividers everywhere. The PPE to the max is followed. We have designated donning and doffing areas. We have extra oral evacuation suctions in every operatory. We basically don't seat the patient next to one another. The distances are followed, especially for procedures that they produce a lot of aerosol. We have new dispensary protocol. In the past, we used to have a lot of things available to the students to basically pick up from the dispensary. Now everything gets packaged and gets delivered to the students. We also have a COVID consent form that is done on every session with every patient. We have another program that, again, I'm very proud of, and that is a basics case presentation. And if you look at these, all these essays, I have not, it's not a mistake. It's actually basics series, spiral series seminars. So what this is a requirement on the 4th year of their education. The 4th year student would pick a case that at least has covered 3 disciplines, and it's a comprehensive treatment for a patient, and basically presents the case to a group of faculty. They overview the case. They talk about the, all the treatment planning analysis of the case and how the outcome was. The 3rd year student talks about evidence-based dentistry regarding the case. The 2nd year student talks about medical or dental anomalies or diseases. And the 1st year student talks about the basic science behind the case. We do have these basic seminars twice a week. They normally are held between 7 to 9 prior to start of the clinic. I want to say almost 100% of our faculty participate in these seminars. In each group, we have probably 4 faculty from different areas: clinical, research, basic science, and it's a very interesting presentation. We have done many interesting presentations, a very interesting program. We have been doing this probably for about 5 or 6 years, and I learned a lot from these presentations. The 4th year student gets graded, and the other 3 basically we write comments, the pass or fail, and these 4 are a part of a pod. So it also makes them work together from 1st year as they come and they get help from each other, they mentor one another. So it's a great way of connecting the students to one another as well. We also have a lot of collaboration and referral to our postgraduate departments. Endo, perio, oral surgery, pros, aesthetic, diagnostic sciences. I have mentioned few of the things that we refer to them, and we don't do them in the predoctoral clinic. We don't do second molars for endo. If there are crowns and we have to go through them, retreatments we don't do, implant placements we don't do in predoctoral clinic, perio-oral surgery or implant center do it. Although we have programs that student can be a part of it and they can place implants. Again, there are major fixed treatments, or if there are vertical dimension that is being compromised, we refer them to the aesthetic or pros department. And oral path and oral medicine, we do refer to them, but we work alongside of them. So our students would learn how to manage the patient. We also have some elective programs that if on your fourth year, you are done with most of your requirements and you want to get stronger in certain area, you can go into those programs, those elective programs, which you can place implants, you can do bigger cases in terms of aesthetic and pros, and many other areas that you can participate. But you have to be in a good standing in your class and done with most of your requirements. Obviously, many of our students also go to week, 2 weeks, sometimes even longer programs if they are interested in going into oral surgery or other programs to just get a feel about different sort of mini residencies that they go. Again, in that case, they have to be in good standing, and we have to make sure they are going to graduate on time before we accept them going into these extra programs. We have a lot of research opportunities at Tufts, probably the most number of research of any dental schools. We do encourage the students to be a part of research projects. They work with postgraduate students, they work with faculty. Right now, I'm running 3 research programs with the students and with the postgraduate students. This is a picture of an annual Bates Andrews poster presentation day, which is a very interesting day. Students do a lot of posters. I am often one of the judges, and we go around and we evaluate them, and actually we give prizes to the first, second, and third presenter. Often these posters become research project and publication. So we encourage a lot of research opportunity at Tufts. Another great program that we have is these volunteer opportunities. We do outreach programs domestically and internationally. We work with elderly, we work with special needs domestically, and we have several groups of faculty and students who go internationally for mission trips to different places, sometimes with med students, sometimes by themselves. This is a group of faculty and students who have gone, I believe, to Dominican Republic. All the people that you see, including this lady, are faculty in the back, and the 3 ladies up front are the students. I just want to tell you that I always hope for the day that we can do the same thing for Iran. And I have approached the leadership to set something up, but because of the political situation, it has not been the easiest. So I'm hoping for the day that we can have a much better relationship and be able to exchange all of this between us. I just want to show you a little video of our clinic for you to get a sense of how everything is done in our clinic.
Welcome to Tufts School of Dental Medicine, where our students spend 4 years expanding their knowledge and craft in dentistry. The first 2 years include preclinical and didactic curriculum in which students learn the basics of dental medicine. They're exposed to traditional and advanced dental care and utilize this simulation lab to emulate everyday practices in clinic. And the views aren't so bad either. By year 3 and 4, students transition into clinic. A typical day for a student begins by changing into hospital scrubs to follow proper PPE. Then they make their way to their lockers where patient casts and dental supplies are held. Each student gets their own locker. They set up their operatories and use the dispensary to gather supplies.
I just want to give my special thanks to 2 of my outstanding students, Lily Razavi and Toro Abu Mahbub, who helped me put this video together. And a very special thanks to Dr. Shakib and Tehran University, who invited me to be a part of this wonderful program. Events like this help us create the unity and strength and exchange of our ideas that we all need. Thank you.
Thank you so much, Dr. Ghaffari. It was wonderful listening to your speech. I'm sure that all of the participants are feeling like me right now. It was very nice to get a sense of how things are done in your faculty, and with your great speech, I'm sure they have enjoyed it as well. But I have some questions for you. In the chat, the participants have written something. If you have the time, I would appreciate it that you would answer.
By all means, go ahead.
Dr. Shakib has written, how do you encourage and train your senior students to become mentor of junior students?
Well, actually, as I mentioned in our pod system, they basically have to do this. Number one, we have TA programs. So we assign students to come and become TAs. Believe it or not, we actually pay our students to come and teach on the clinical floor. It's a nominal payment, but it's sort of an honor system. You have to have a certain standing to become TA. You have to apply for the job. You have to you go through a process, and faculty have to approve you to become a teaching assistant in the clinic. So that is one part that we do. Another part is the pod program. They become senior partners and they work directly with their junior partners. So if you're a senior and you have a group of, let's say, 40 patients, you started them, and now, for instance, if the student no longer needs operative and the patients have operative, what they do is they book their patient with the third year and they go through the process with them. Um, they help them with the first time that they're doing it before the third year comes and works. The third year helps the fourth year as an assistant. So it's a really nice collegiality and working together for both of them. It's a sort of, we help each other. And also that mentorship really helps the junior to get more comfortable. And also they connect the patient to the next provider. And since this patient has that trust in their original provider, it's much easier to, to be introduced to the next person. So we do it really nicely and students love it. And if they don't like their partners, it's just basically too bad. They have to get used to working together, learning to deal with one another, and be able to work together. In a real world, we don't pick our partners to work in a dental office. So it works quite nicely.
Yeah, thank you so much. It was a complete answer and very great. The second question is, who is in charge of training students for head and neck cancer screening?
Mostly, we do the oral pathology that their lecture normally, covers the head and neck, but overall also practice coordinators, as they are examining patients as they come in, we go through the whole thing with the students. So pretty much from many different areas, we examine them.
Thank you so much. The third question is, this question is from one of our applicants from Romania. He asked, as an international trained dentist from Romania, I would very much like to continue my studies at your university. I know that there are two ways to do that, an advanced training program or a specialty program. Which one would you recommend?
If you are a dentist from any country and you want to come and practice general dentistry in here, we have an international program, which is 2 years. So you have to go through 2 years of training here and then take all the examination and be able to work as a general dentist in US. If, let's say, you're in Romania or you're in Iran or wherever, and you just want to become a specialist and go back to your country and practice, then you can go to any of the specialty programs and get trained and go to your country or stay and teach. As a practicing dentist, you can actually come to our university and teach, but you cannot practice in a private practice setting. I don't know if I answered the question or there was anything else that they wanted me to answer better.
What you mean is that if someone wants to just study there as a resident or come back to his or her country, she or he should just apply for the program without that 2-year equivalency program for the US dentists, yeah?
Yes, absolutely. You can apply to any program and, you can go to any program you want. And we also have a program that is really an amazing program. Very few schools have them. Let's say you come to our school and you do perio for 3 years and you become a periodontist. You can actually apply for a job as a faculty member in our university. And after a couple of years, depending on the amount of applicants, you can go through a faculty track. And faculty track is by far easier than going through the 2 years of international program. It is, first of all, free for you to go through the faculty track. You're actually getting paid as a faculty, but you do some of the requirements. After 2 years, you get your DMD degree, which means you can work in a private practice setting here, and also you have worked in the university as a faculty member. The only drawback is there is a contract that you have to sign. I think you have to work about 2 years in the university as a faculty member until you can go and work privately. But this is a really unique program. I always encourage people to take advantage of it because there's a handful of schools that do that. And in Boston, I think we are the only school who would do that.
That's a wonderful opportunity for the ones who apply for it.
Yeah, it's an absolutely wonderful opportunity.
So I may go to the next question. Which department is in charge of holding tumor board?
It is to some degree goes to oral surgery, and to some degree goes to medicine. So both areas deal with those.
Thank you so much. And the next question was from me. Have you actually vaccinated the students or the faculty members at your?
Yeah. Actually, we are finished with all the vaccination of first and second vaccine for all the faculty and students in our university. And that was lucky because we are affiliated with a hospital that actually were gracious enough to give us the opportunity to do the vaccination. And it was a monumental job to get 2,000 people vaccinated. But in fact, tomorrow will be the 2 weeks after my second vaccination. So I feel pretty good.
Wow, that's amazing. I hope that we could do so one day in our faculty. Yeah,
I hope so very soon, hopefully.
Yeah, we didn't receive any vaccine yet, so I hope that we will soon. And the last question is it possible to have your email address?
Absolutely. I will provide it for you, and you can, let people have it. I have no problem. I'd be more than happy to answer any question you guys have. I truly thank you for putting this program together. I think it's amazing. You guys are very special for me. And I actually, believe it or not, I had a shoulder surgery and I didn't think I'm going to be able to make it, but I'm glad I did. It is an honor. I'm delighted to be a part of this. And I'm hoping someday soon to come and visit you guys in person and see your facility and learn from you guys.
Thank you so much. It was such an honor to have you with us here in this virtual winter school. And I wish that it was not virtual so that we could have this conversation actually here in our faculty. But I hope this corona pandemic gets over soon so that we could do so. But anyway, it was such an honor to have you as our speaker here. And I hope we do more collaborations and more programs together in the future. But one thing, another person asked something, so I will count it as the last question. Amir Hossein Raji has asked, can you work in other states after the 2-year obligatory work period for the faculty track program is passed?
Yes, basically, depends. We have many different laws in the United States. So you cannot take one exam and be able to work everywhere. Every board's exam covers an area of United States. The Southern board could be different than Western board, could be different than Northeastern board. You have to go to the website of that state and see what kind of, to their mass society, website and see what kind of board they require. And yes, you do the 2 years, and then you can take any exam you want and go to any area you want to. It is an actual license that you have. You can use it anywhere as long as you have passed the written and the practical part of the boards. Absolutely.
Thank you, Dr. Ghaffari, so much for answering that question as well. I hope that you have enjoyed this program as well. And again, I would like to express my sincere appreciation for having you with us today. And if it's okay, I would like to ask the applicants to turn on their camera so that we could take a memory picture for the second day. And I would like you to stay as well.
Sure. My pleasure.
Thank you. It's our honor. Wow. Hi, everyone. I hope you have enjoyed the program in the second day too. Yeah, we are taking the pictures. Wow, I see so many familiar faces from the ice-breaking session. Thank you, everyone. Thank you again for joining us. Thank you, Dr. Ghaffari. I would like to invite you all for participating tomorrow as well. Tomorrow at 8, my colleague and I are going to hold a panel about COVID-19 and dentistry, actually 8 a.m. Tehran time. GMT is sooner. And I would like to see these faces in the COVID panel too. I hope you stay safe. And I hope you enjoy the rest of the afternoon with your family and beloved ones. Thank you so much. And thank you again, Dr. Ghaffari. See you tomorrow. Thank you. Bye.